Welcome, everybody. We're going to start the second day of the conference that now I remember the title of the conference for a change. It's Policy Challenges in a Complex World. Do you see? I did my homework. So thank you all for coming early on a Friday. It's a pleasure to have you all here, many from, far away. So we have a panel that we titled Poverty, Income, and Wealth Inequality. We're going to have 4 presentations. We're going to go in a peculiar order, I suppose, because it's not in alphabetical order anymore. Stephan Lefebvre from Bucknell University will present first. Then Aashima Sinha from the Levy Institute will present. Then Tom Masterson, also from the Levy Institute, and Aileen Doherty from John Jay will be the last to present. You'll have 15 minutes each so that we'll have some time to have questions. Beforehand, I'll let you know that I'm going to show you a 5-minute and a 2-minute sort of warning. And yeah, that's it. So Stephan, I think your presentation is up there.
All right, hello, thank you for having me. Good morning, my name is Stephan Lefebvre, and I'm a professor here at Bucknell University. It's so great that we have a nice turnout. Thank you so much for everyone, particularly the non-Bucknell folks that made a slightly longer trip than the rest of us and are enriching our kind of research and intellectual lives. I'm going to present on Medicaid eligibility and asset accumulation. This is a work in progress, and I was talking to Tom earlier today. I'm still figuring out what I did wrong and right with the data analysis, but this project has been on the back burner for a while. I'm coming back to it after a break, and the terrain has changed with Medicaid, but it doesn't really change too much of my story. And I still like this kind of question and motivation. So Medicaid is a program that currently today about 70 million people receive their health insurance in the US through Medicaid. It's about 1 in 5 in the population. And we also see that there's different ways to measure this, but something like 1 in 5 households have 0 or negative net worth. Medicaid as a program grew from a program that was closely tied to welfare assistance for what they called needy families and children. It was decoupled from that, and it became a way for people to get health insurance when they were out of work or working low-wage jobs that did not come with health insurance. You see this growth of Medicaid here. There's a large spike with COVID-19. The graph stops at 2022. Since 2022, we've had a steady decline because during COVID, there was a pause in disenrollments from Medicaid, and now we're going back. And I think some people are being disenrolled because maybe their status changed. So anyway, it's not quite at the height of that. We're down to about 70 million. My study asks, do individuals that receive Medicaid experience changes in their ability to save, in their ability to accumulate assets, or their accumulation of debt? It's grounded in economic theory. The core theoretical frameworks in economics explaining individual debt and savings say that people save for primarily 2 reasons. Number one is consumption smoothing. So our income or our employment spells may be bumpy, but we save to be able to pay that rent every month on a steady basis. That our ability to have that go up and down is not within our control as much. And also there's precautionary savings, this precautionary savings motive. Individuals anticipate having to pay for things like healthcare costs in the future, and so they save for that eventuality. The interesting thing, though, is if people are saving because they anticipate future medical expenses, then if you give them Medicaid, they may save less. That is one of the conclusions of precautionary savings theory, right? In the absence of saving constraints, theory predicts that public health insurance will crowd out personal savings. And this is a problem for some people who want to attack programs like Medicaid. They say, we're not really helping people, they're just saving less. So that's my research question. Estimate the effect of Medicaid eligibility on individual net worth and its components, asset and debt, for those most likely affected by the policy. So if precautionary savings theory says that if you give someone Medicaid, they're going to save less, does that really happen? My first step is to take a look at the averages without any sort of manipulation. And so this is non-Medicaid minus Medicaid. So positive numbers mean that people who, this is supporting that theory, right? People that do not have Medicaid have higher savings, and people who have Medicaid have lower savings. This is just looking at people less than 400% of the federal poverty line. I'm using the SIP, Survey of Income and Program Participation. I'm using the SIP. I divided up the population into 20 income bins, and these are the 20 dots that you see here. So when we look at the data just on averages, we see that people with Medicaid do have lower assets, but there's lots of explanations for this. The first being that, so it could be precautionary savings, or it could be that the program is means tested. So there's not just an income test. It's not just the fact that depending on the state that you live in, your income needs to be less than 400% of the federal poverty line, but there's also asset tests. And those asset tests are very low. They haven't been updated. So even having more than $2,000 in assets could disqualify you from Medicaid. So that could be one explanation here. Another broader explanation is just selection. The way I like to say it, one of my econometric students is here. The way I like to say it is that people who receive Medicaid and people who do not receive Medicaid are different from each other, not just in the fact that they receive Medicaid. So the difference here cannot be attributed to just that one program. What are other ways other channels for these effects? What does subsidized health insurance mean for families facing low wages, right? First of all, receiving Medicaid could improve your health and well-being through better access to healthcare. It could decrease your health spending. It could affect your susceptibility to debt and bankruptcy. All of these you could think of these as channels, multiple mediators for how we get from health insurance to wealth, which is my main question in this paper. There's also job market effects. Job lock refers to the idea that individuals sometimes stay in jobs to maintain employer-sponsored health insurance. Job push is similar, where individuals leave jobs for heavily influenced by the reason that they're going to be able to get health insurance at a different job, even if it means lower income or other negative job characteristics. And lastly, behavioral economics, we could potentially see longer planning horizons. This freedom from the worry of catastrophic health or health challenges creating a catastrophic financial situation is alleviated. And so maybe people behave differently in terms of their financial planning. There is qualitative evidence from this. So it's really tiny. No, it's not that tiny. It's tiny on my screen, but there are studies. People went out with a microphone, interviewed people who just got access to health insurance, and these are the things they said. I make very little over the summer months and wish I had more money saved up to allow me to support myself during this time. I do worry a lot about my car. It is a 1986, and so far I've saved $1,400 towards replacing it when the time comes. I don't want to be destitute again. Living in poverty is one thing, I can deal with that. Destitute is a whole other thing. That's from a Kansas Medicaid buy-in program. There was another study that happened where they interviewed individuals in Philadelphia. I hate to say those words, but I'm going to say that. I have dental tools. I was doing my own dentistry. I shouldn't be doing that. I don't know what I'm doing. I was going on YouTube and seeing how to do the dentistry. Right? Pretty harrowing. The first thing I did was visit the doctor just to make sure I didn't have high blood pressure or diabetes or anything like that. So these are some of the, this is, when I think about families receiving Medicaid, I don't think about them now having lower savings. I think about all of the ways that that affects someone's life. There is this endogeneity problem. We can't just compare people who get Medicaid and people who don't to figure out the effect of Medicaid because there are, let me give you the definitions here. There are factors like X, which is just characteristics that people who are eligible for Medicaid and there are correlations. X are correlations between people who get Medicaid and people with high or low wealth. You know, the X variables there, the X correlations are observed. We can control for those. That's not a problem. But the epsilon ones are preventing us from, even with the controls, estimating a causal relationship between eligibility for Medicaid and mediated through all of these channels. You know, we could separate those out in this paper. I'm not planning to, but how that affects wealth. So I'll tell you about how I'm solving that or how I'm planning to address that. The empirical strategy is instrumental variables. So I'm constructing an instrument that will generate plausibly random variation in eligibility for Medicaid, right? Let me back up a little bit. That was a lot of vocab words, but backing up is, if I had a magic wand, what would be the ideal experiment? The ideal experiment is I would like to see someone's wealth in a situation where they do not qualify for Medicaid, and someone's wealth, same thing, everything else held constant, where the eligibility rules change and they do qualify for Medicaid. How would their wealth be different? So you can imagine the regression equation here is I'm looking at the effect of eligibility. Beta 1 would be the coefficient of interest and controlling for things. I can't use eligibility directly, so I instrument using the probability of eligibility. So here's how I do that. I take 300 individuals from nationally. I just randomly pick 300 individuals. And then I start moving them around to every different state and every different year. And I calculate for each of these, for state, year, and demographic group cells, for state, year, and demographic group cells, I calculate their probability of being eligible for Medicaid. So for each individual then, I get a different value of their predicted eligibility for Medicaid that is orthogonal to or not correlated with their actual actual characteristics, except for their state and their characteristics that get them into that cell. Okay. I can show you some preliminary results, right? So this is starting to get you to where how my results are developing. I have 2 columns here, or 3 columns with OLS first stage and IV, and then the same thing. The difference between I guess the 2 sets of 3 is controlling for the percentage of people in the cell, in the state under the federal poverty line. So here's the rub with this, right? I am looking at the Medicaid expansion years, which give me plausible variation in Medicaid eligibility. In other words, Medicaid eligibility rules were changing around the years 2014, 2015, 2016, and I can take advantage of that to estimate this other thing, right? I'm not really I'm not studying Medicaid during that time. I'm just using that variation to estimate the effect of public health insurance on private savings. But Medicaid rollout was not random across states, right? Democratic states took up this Medicaid expansion sooner, and in some ways, Republican states either came late or some of them never did. So I need, in addition to my instrument, I need controls for the states. So here, there's plenty of them controlling for the percent below the federal poverty line, controlling for the state unemployment rate, controlling for state production, GSP, the gross state product, the TANF caseload, and I have some individual controls here as well. Thank you. College, education, and gender. The OLS results, the kind of naive regression results, show that Medicaid eligibility is associated with less assets. This matches the graph that I showed in the beginning. Because I have a logged dependent variable, you have to kind of take e to the like negative 2.46 power. So that would be a huge decrease in Medicaid. What's more believable is the IV estimates. So here, for example, 0.53 would equate to a 70% increase in assets. So you do get this change from negative coefficients to positive. I still have work to do to make sure that these numbers are something that I would be comfortable putting out there into the world. Some of the tricky things about this research is that predicting people's Medicaid eligibility based on survey results is not always exact. Like I predict 12% of the sample, I predict that they are not Medicaid eligible, but then in the SIP, they tell me they have Medicaid. So, but that's characteristic of a lot of this research. And if I have 1 minute left, I'll just, that's it. That was my last slide. I also look at the other dependent variables. I look at asset and debt by different education groups and by different race groups. These are the IV results. So we see an increase in assets and an increase in debt. And actually, I'll leave it here. Thank you so much.
So today I will be presenting part of a broader project we are doing at Levy Institute, and that's why the swap between me and Tom, because Tom will be presenting some follow-ups of that, like the second segment of that. This project is a joint work of, and the co-authors are Ajit Zacarias, Tom Masterson, and Fernando Rios. So this research basically is about accounting for what we call time poverty. We are constructing this time-adjusted augmented measure of poverty called the Levy Institute Measure of Time and Income Poverty, LIMTIP. The idea is really to account for the value of household production, which basically includes domestic chores, cooking, cleaning, washing, laundry, and so on, but also caregiving, childcare and adult care. So basically that gets missed out in the official poverty statistics, which I'm going to discuss briefly again. LIMTIP has been developed for a range of different countries. So this project has been around at Levy Institute for a long time now. And it's the first time that we are developing it for the United States. The motivation really boils down to the fact that we want to account for time poverty. Time poverty is really the lack of time for essential activities, such as household production primarily. It's an often overlooked dimension of well-being in the sense that time deficits and time poverty are not accounted for when we are estimating some of these official standard poverty estimates. So these standard measures of poverty, they're actually failing to capture these hardships that are caused by time deficits because they're only focusing on income thresholds there. And as a result, we do not have a complete picture of for effective poverty alleviation programs. So we are leaving out people who are struggling with income poverty, but also have time deficits. Our research is very much rooted in the 3R strategy of Diane Elson, the recognition, reduction, and redistribution of unpaid care work. And in this particular project, we are specifically focusing on the recognition part. So we're coming up with this estimates of LIMTIP, which accounts for household production work. And the second segment of it also involves redistribution of this unpaid work. So what happens if we were to do some simulations around redistributing household production work? Would that have an impact on time poverty? But that's not something I'm going to be presenting today. And then we also have some employment simulations, which Tom will be presenting. The important part is that there's a gender unequal dimension to it because this household production is unequally distributed between men and women within households, and thereby the consequences are also unequal. So the standard poverty thresholds, just going back a little in time, there's a critique of the official US poverty thresholds. Claire Vickrey pointed that out, that surviving with this minimum basket or the poverty level income, that really requires a certain amount of household production in the background. And it's assumed that it's being taken care of when we are calculating those income thresholds. So we don't want to assume that. We want to kind of make that visible. So for example, surviving with this poverty level income is possible if we assume that that most of these meals are prepared at home with the low price ingredients shopped from the cheapest possible retail outlets, for example. So the proposal was to really assign a monetary value to this shortfall in the requisite labor, the labor input that goes into household production, and add that monetized value of time deficit to the conventional poverty line. So building further on this idea and also accounting for this intra-household disparity in sharing of this household production, the Levy Institute came up with this measure of time and income poverty. Just a very basic idea of how we're calculating it. So we first do an estimation of a weekly time balance. So let's say we have 168 hours, 24 hours into 7. In a week, and then we deduct from it the sum of the average time spent on sleeping, eating, the regular activities classified under personal maintenance that we call M. And then we also deduct from it the required hours of household production, the R that we see there. And that in turn is based on a statistical conditional expectation function model, where we estimate based on the household structure, the number of adults, the number of children, and so on. We come up with this threshold for the required hours of household production. And then for those who are employed, we also deduct the time that they would spend on paid work activities and the time they spent on commuting, the last component that you see there, DI and T and the L. So this is at the individual level, the time balance. Then we aggregate that at the household level because all the income poverty official stats are at the household levels, and then also they are annualized. So first, the second equation that we see there is basically aggregating that at the household level, and then finally attaching a monetary value to it, which in the last equation. So this P that we use is really the wages for the industry private household. We use that as the replacement cost of this household production work. We use that and also multiply that with 52 to get to the annual numbers and add that to the official poverty thresholds, the PO, to get the time adjusted measure of poverty. Now for this, to do this, we needed a data set that would have information not just on employment, income, poverty, but also time use, because we wanted that time spent on household production. So, but we don't have such a data set for the US and from several other countries. So what we ended up doing, we statistically matched, there's a technique called statistical matching, and we have a separate methods paper on that. If some of you are interested, we can share that. So we applied that technique to combine the American Time Use Survey data and the annual social and economic supplement of the current population survey. The idea really is to impute for those in the ASEC the time spent on some of these activities required to estimate the limit. And then using this data, we then finally estimate the limit for 2007 to 2022. So we have it for several years. And followed by this, we have those two subsegments of this project where we're doing the redistribution simulations, as I said, and also the employment simulations, like how would limit estimates change if we were to engage in some of these simulations. So just a bit of background on what are the baseline time spent in household production trends. So it's unequally distributed between men and women. Women spend around 1.6 times more time in household production activities, and this has remained more or less stagnant around 1.6 over the years. So it has been unequal for a while. Even if you were to look at time deficits, coming from that time balance equation, that again has been unequal. So women are experiencing greater time deficits compared to men. And then if we were to look at where this is concentrated, where this time poverty, which is the share of people experiencing time deficits, where it's concentrated, it is concentrated among employed because they are the ones juggling with their paid work activities and also household production work. So that's where we see it's concentrated. But again, that gender disparity, if you see, it's very evident. And if you were to look at the levels of different hours of employment time, that again shows gender disparity. But what we see here is that that's more kind of more prominent in the middle ranges of the employment hours, 36 to 50 hours. That has the most significant gender disparity there. And the idea is that it remains across all employment hours, so that gender disparity doesn't change across hours. And then we were interested in looking at how this time poverty would change if we were to look at some of the household structures, including and demographics, the marital status as well as parental status. So this bottom rightmost chart here, it's showing when if you were to restrict it to the sample of single and no kids, that's the time poverty that they experience. It's still there around 20% and hardly any gender disparity. But for those who are married and yet no kids, we see that there is an increase in women's time poverty, which is more significant than men's. And then when I'm using significant right now is just the magnitude I'm talking about. But yeah, so what we see is that as soon as we move to the marriage sample, we do observe an increase in time poverty, more significant for women. And then when we move to those who are married and have kids, if you see there's a kind of a huge jump in time poverty and also in gender disparity. It's much wider than when there were no kids. And then what's interesting is that single parents, single men and single women who are parents, there is hardly any gender disparity, and they do have a very high level of time poverty compared to married, no kids. So there is sort of that marital penalty and parental penalty, and then that's also kind of widening the gender disparity in different ways across these different segments. Just briefly, a note here that the popular notion is that there may be difficulties in reconciling home responsibilities and job commitments, which are more prevalent among those in higher rungs of occupational hierarchy. So more, doctors and lawyers who are more busy with their clients and so on, and with their patients, they might be experiencing higher, time poverty. But what we're actually see, and I mean, kind of that in turn indicates that income poor may be less prone to time deficits than income non-poor. But what our estimates are showing that uh, income poor men and women, they have higher rates of time poverty than their income non-poor counterparts actually. In fact, about 1/4 and 1/3 of income poor men and women, they are time poor. And for those who are income non-poor, the blue bars here, uh, it could be the case that they're actually ending up outsourcing most of their household production needs, buying some market substitutes and so on. And then we were also interested in looking at some of the race disparities and further also intersectional gender and race intersections, which we have in the paper, not so much here on the presentation. But on this one, what we're seeing that the gender gap remains intact across these racial groups. It's somewhat surprising that racial groups within each gender, they're pretty small, those disparities. So if you see like the disparity across racial groups within the women category as well as within the men, that's not significant, but between men and women, that gap remains intact. And then, and this was basically time poverty. And if we were to look at the income adjusted for this time poverty, that LIMTIP estimate really, then the racial disparities are more prominent. So, income poverty rates are dramatically lower for whites, if you see here. And I should have actually explained this. So the SPM is really the supplemental poverty measure, the official, poverty, the extended measure of poverty there. And then LIMTIP is what when we account for time adjusted time deficits. So if you were to look at this, the SPM, of course, there's racial disparity there, but even after accounting for time deficit, that disparity is actually increasing, and blacks are twice as prone to poverty as whites, as well as Hispanics, who are nearly 3 times as prone to poverty compared to whites. And then this is really what we kind of arriving at. If we have the SPM, the official supplemental poverty measure there, and if we were to account for LIMTIP at the household level, this is the difference that we are seeing, and we're really wanting to identify the hidden poor. So the gap between the two is the hidden poor. And those are actually left out if we were to only focus on the official poverty estimates, ignoring time deficits. And then just briefly, the poverty rates of people in employed households by measure, again, if we were to kind of, there are more detailed intersectional analysis in the paper, but here just pointing out that people of color and Hispanics, they are experiencing the highest limited poverty as well as SPM, and they are the most hidden poor that we call them. And then they are concentrated within single family households and also concentrated within single female family households. So basically, the idea is to really disaggregate some of these limited estimates by household structure, marital status, and so on to have that broader picture in place. I'm just going to conclude. So time poverty is mostly concentrated in the employed population in the US. It falls more often on the income poor than income non-poor. There's a gender dimension there. Incidence of time poverty is much higher for women than for men. And within time poor individuals, women face greater time deficits compared to men. So even the intensity is, there is a disparity in intensity as well. The racial disparity, time-adjusted income poverty shows more prominent disparity. 1 out of every 10 employed people were limited income poor during 2007 to 2022. And these rates were higher for people of color as 13%, still higher for Hispanics, around 18%, and highest for single mothers. So again, that household structure plays a role there. Marriage increases time poverty for women by a greater margin than men. And having children further increases time poverty for married and single mothers, again by a much greater margin compared to married fathers. Some of the policy implications really, so this time-adjusted poverty measure, it would help us identify those left out of the official income poverty estimates, making them visible in some of the poverty alleviation programs, which is critical. LIMTIP and time poverty estimates could be used as a tool for intersectional analysis by region, race, and gender, which in turn can help devise more targeted policies. Of course, there are some kind of econometric issues there if you were to do that intersectional analysis, but it is possible in principle to use these as tools to do that. And time poverty, which we saw it's concentrated among employed, so clearly employment alone is not kind of under the existing policy and labor market conditions, not sufficient to address poverty. So there could be some other policy opportunities that we are thinking about. And some of it could be more collective action, extending union coverage, activating labor markets, labor movements primarily to fight for better pay and working conditions as well as shorter hours. Investment in care infrastructure and services, a very standard policy implication of this, which may not be very viable in the current political scenario, but the idea really is to kind of reduce the burden of that household production work, the required hours of household production. And then some of the kind of other policy opportunities are also just targeting social norms because there's such a gender unequal dimension attached to this. And given the kind of restricted government support for these low-income families and workers in the current times, there might be some value in exploring community-level efforts in the interim until we get back on track. Thank you. And we also actually have a Masters of Arts and Science program at Levy Institute, just advertising a bit on that. There's this scan code, and we also have some pamphlets with us if you're interested. But other than that, for our work on time and income poverty, you can check out our website. We have some upcoming policy notes as well as working papers there. Thank you.
Thank you, Aashima. Thank you, Aashima. So we're gonna go with Tom. I'm just gonna open here. I should say I highly recommend everything from the Levy. It's my old house too. So okay. So I'll just first say I prepared my slides before I knew that we were going to be in the same session. So I have some. There are some duplicates here. But anyway, same project that Aashima talked about, where we've been working on developing estimates for the time and income poverty in the U.S. Between 2008 and 2022. So what I'm going to present here today is the results of some employment simulations that I am doing, I should say. I was almost going to say I did, but I'm still in the process of doing. I'm on the fourth iteration or so of finding things I did wrong. Just to kind of start at the end, what we find is that employment has a limited ability to lift U.S. households out of poverty.
given the current labor market situation. Okay. So sorry to let you know that. So with some caveats, but I'll talk about those. So relatively few households are in a position to improve their situations through employment, given the US labor market. Not just today, but I mean, we're obviously, I'm not presenting estimates for 2025, but between 2008 and 2022, that's true throughout. Okay, so just to know that we're going to be depressed, we can dive in. So Aashima already talked a bit about the motivation for the overall project, so I can kind of skip over this. This is good stuff, but like Aashima said, we've been this research program has addressed the 3 R's, right? So recognition, reduction. We've got a bunch of macro, micro models of social infrastructure expansion to kind of address the reduction and redistribution. That's, stay tuned for another presentation at some point in the future on that. But at the same time, poverty in general, right, is frequently framed as something that employment can fix, right? Either because of kind of blame the victim bootstrap kind of argument, right? So people are poor because they just won't work, right? That's the rhetoric. But also, things like inclusive growth programs that will, lift people out of poverty because, magic, especially in development contexts. And also in employment of last resort, although this is, I will say, this is more promising than either the inclusive growth or, the just go out and work approaches. Okay, so why a time income? I'll skip over this because, Aashima already did a very good job covering this. So you can see I was ready. There will be a quiz later. Okay, so the data source, as Aashima mentioned, the base data set is a synthetic data set created by statistically matching the American Time Use Survey with the annual social and economic survey from the current population survey, so the March survey. We also use the merge outgoing rotations group data to get the wage data for the replacement costs of time deficits. Okay, so the period, we have, there's time use surveys available, although now there's also one for 2023 available at this point, but we used up to 2022. And just to talk about the difference between the official poverty measure and the supplemental poverty measure. So got it? That's a little humor there. It's a big table, but there's a little difference in the unit, right? So the official poverty measure is families or unrelated individuals. The supplemental poverty measure uses resource units. So you'll be hearing me talking about SPM units, which is a fun thing to say, but mostly you can think of them as households. The poverty threshold is not based on 3 times the cost of a minimum food basket in 1963, adjusted for inflation, but based on recent expenditures of food, clothing, shelter, utilities, telephone, and internet, right? So things that people are actually spending money on now. So that's nice. All this is to say that the SPM unit, the SPM poverty measure is better, and that's the one we're using, right? So also the resource measure for official poverty is just gross before tax cash income, right? Which is not a great measure, right? So the resource measure for the supplemental poverty measure is cash income, non-cash benefits, minus taxes, work expenses, medical expenses, and child support, okay? So better, in short, right? And it'll be important in a second when I talk about how we adjust things after we assign employment. Okay, so LIMTIP, again, Aashima already presented this. This is the individual time balance. So we calculate that for the year, and then we add up all the deficits in the household. We don't subtract out the surpluses because we don't observe people picking up the slack. And so we get an adjusted time-adjusted poverty threshold. So that gives us a 2-dimensional poverty measure, right? Households are income poor if the household income is less than the supplemental poverty measure. adjusted by the time deficit, and the household's time poor if anybody in the household has a time deficit. So if anybody's time poor. And at the individual level, individuals are income poor if the household is, and they're time poor if they have a time deficit. Okay? So that's the thing. So the employment simulation, right, is designed to see if poor households are in a position to lift themselves out of poverty by their bootstraps, so to speak, right? So for each poor household, what's the potential impact of employment on time and income poverty? And so this is not a policy simulation. Right? It's not a general equilibrium or partial equilibrium model. We're just looking at each household. What are the jobs that the individuals that aren't already working in those households likely to be able to get, and what impact would that have on time and income poverty for the household? Right? Long story short, not much, unfortunately. So first we identify recipient and donors. Right? The recipients are individuals, adults in income poor households that are not retired or in school and that are physically able to work. And then donor records are people who are working. Simple. So then we impute industry occupation wages and hours for each recipient. So for everybody that's not working, we figure out what's the most likely industry, what's the most likely occupation. Given that, what are the wages and hours they'd be likely to receive if they got their most likely job by industry and occupation. Then we match recipients with donors. And so we don't actually use those imputations, the wages and hours, as imputed wages and hours, but we use them to match with donors. Right. So what we're doing is a matching procedure. It's a hot decking match. So we find the individual with a similar character, with the most similar characteristics that's working, and assign the same job, basically, to that person. Right. Reasoning that that's the job that this individual that's not working would be likely to get. So we transfer the wages, the hours, the weeks of work. Okay, but we're not done. We then assess the earnings impact on the SPM unit. So there's a lot behind all this, but so we look at not just the impact on changes in earnings, but also changes in taxes, changes in non-cash benefits, cash benefits for the individual and at the household, at the SPM unit level, and figure out, well, given all that change, would they actually take the job? Right. So, and we basically decide, we arbitrarily assigned a level of, if their individual contribution is 75% higher than before, then we would. Okay, so then once we've decided who will take the job, that's possible, we reassign household production hours within that household. Right, so each, in the LIMTIP calculation of the time balance, we assign a share of the required hours of household production for that household to each individual based on their observed share, right? So we have to reassign shares. And so we do that by another set of matching for all the individuals in recipient households with individuals in other households that actually have everybody working already. Okay? So to kind of reproduce a distribution of household production hours among a household where everybody's working. Okay. And then we recalculate time and income poverty. Okay? Simple, right? So there's like 1,000 lines of code or so, but simple. Okay, so let's move on to results. So these are the job recipients in the simulation. So this is the number of individuals that we calculate would take the job that we're most likely to get, right? And you can see that there are more women than men in every year, and that's due to lower labor force participation rates for women, generally speaking. 5 minutes, no problem. And it's not a small number. It's smaller in 2021 than in any other year, but in 2022, the last year, it's almost 6 million, right? Okay. Okay. So this is the time poverty before, with and without the simulation. right, for employed adults by sex, right? So as you no doubt remember from Aashima's presentation, time poverty rates are higher for women than for men who are employed, and time poverty is concentrated among the employed. So the interesting thing here is that the simulation, right? In the simulation, the poverty rates of employed adults is lower, time poverty rates. Interesting. This is unusual, and in other countries that we've done these simulations, time poverty rates go up because people work, so more hours of work, less time, right? But as it happens in this simulation, partly due to the readjustment of benefits, but also partly due to the fact that almost all of the recipients are not time poor to begin with and have about 45 hours per week free, right? Their time balance is 45 hours per week. So when they get a job, they don't become time poor. Time poverty rates actually decrease overall. Okay? In fact, so in 2022, as I mentioned, there's like 6 million job recipients. Only 200,000 of them were time poor before the simulation. Okay. All the others were not time poor. Okay. So that's easy to absorb, I'm sure. But this is our two-way measure, right? So time and income poverty. So these green, the green is income poor and time poor, right? The blue is income poor but not time poor. I'll call this orange and say that's not income poor but time poor. Then purple is income non-poor, time non-poor. So that's where you want to be, right? And this is for job recipients in the simulation by year, by their time poverty status before the simulation, right? So note the time poor, right? Like I said, this is very few people, right? Which you'll see the difference when I show you the next slide by sex. Basically, if people are time poor to begin with, they have a low likelihood of leaving income poverty, right? Lower likelihood than if they were time non, right? Whereas in 2022, if you look, there's 36% of the time non-poor remain income poor, but 64% get out of income poverty. So that's considerable. If we look at the same breakdown by sex, right? It's like, are these the same numbers? Are you sure? Yes, I'm sure, because as I said before, the time poor, right? These people on the green with the green here, the high levels of time poverty, right? 2/3 of the time poor remain time poor. They're very low in the overall. Is that's not me, is it? No. Okay, good. Okay. So very low rates of time poverty among job recipients, right? Because there were low rates to begin with. Okay. Looking at SPM units, or just households if you want, the actual and simulated income, time-adjusted income poverty rates, 2 minutes, no problem. So this is the official SPM poverty rate, right, of the actual data, right? And you can see this dip in 2021. So this is what Derek was talking about last night, right? So during the pandemic, we suddenly realized, oh, we can do a basic income guarantee, no problem. We just do it, right? And then in 22, we realized, oh no, we can't, and stopped. So that's what we're seeing there. That's why the big dip in poverty in all of these measures. But the time-adjusted poverty, right, is the blue line, and you can see that's higher. And so the difference is hidden poverty, as Aashima mentioned before. And among employed SPM units, right, poverty rates are higher in the simulation than in the actual situation, right? And this is because of the The denominator in the simulation includes all of the households with job recipients in the simulation, right? And poverty rates are very high among those. Very few of those job recipients were able to get their households out of poverty, right? So the denominator is higher, but the numerator has not changed. So that's why you have higher poverty among employed households when you figure out if poor households can get, what happens if they get jobs. Okay, so as we can see, so the orange and purple is the people that get the SPM units that get out of poverty, right? Very few. Okay, so long story short, employment can reduce income poverty, but not in this case, and certainly not much. Not many people get out. It decreases time poverty, but not very much. And it requires complementary policies to reduce unpaid work time. And you know, I think one takeaway from this is that there's a reason why poor people that aren't working don't work. Right? It's because it's not worth it to them. Also, another important thing is that the people that cannot escape poverty, right? So 41% of poor SPM units already have every adult working. Another 46% don't have any adults in the household that could work. Right? They're retired, they're disabled, or they're in school. Right? So we don't force people to take jobs if they're in school. So that leaves 13% of households that could feasibly get a job. Right? And something like half of them will get a job that is sufficiently, pays sufficiently well to make up for the loss in benefits. But most of them don't get out of poverty that way. Right? But they have lifted themselves up by their bootstraps, so I guess that's something. So quality affordable childcare would be an important addition. So thank you very much. And,
Thank you, Tom. So I think he's saying that the poor house doesn't work. And we have the last would be Aileen, yes, of the session. Thank you, everybody, so far for keeping in time. Let me just.
Hi, everybody, and welcome. Thank you for having me here. So, my paper and my research is a combination of constitutional law as well and an understanding of government responsibilities under the Constitution. And then also looking at specific policies, both at the federal and state and city, New York level, to see if the government is actually complying with their requirements and obligations under the Constitution. Um, so it's called The American Experiment and the Unfinished Revolution. I'm going to focus on housing in this presentation. Housing as a right and capitalism as a demand, because it appears that despite our fundamental rights and obligations of government, somehow capitalism has upsurged the government's policy-making decisions. So, okay, let me see if I get this right. The basis, I believe, of the founding fathers' principles is Aristotle. And Aristotle wrote extensively on happiness. And his belief was the pursuit of happiness is a reason for living a life. And it's a life of virtue. And the purpose of that is to fulfill one's full potential. Now, Jefferson was also very profoundly impacted by this and his views on happiness, especially. And so the pursuit of happiness, as you know, is an essential part of the social compact that's set forth in the Declaration of Independence, and I will argue the US Constitution, as woven through the words of Hamilton, Lincoln, and Roosevelt, and now incorporated in the UN Declaration of Human Rights. My belief, especially with the words of Roosevelt and the UN Declaration, is the pursuit of happiness requires that the individual have economic security. The social compact requires the government provide the environment by which that economic security may be obtained. My consensus is that modern neoliberal policy, including the focus on capitalism, has grossly disfigured the founding principles and global standard, removing virtue from the definition and government from its obligations. COVID has provided stark evidence that the neoliberal policies have destabilized the economic system, the democratic process, and are unsustainable, making the achievement of happiness out of reach. After such destruction, I'm hopeful, but that was 2 years ago, so I'm not sure about right now, but we'll worry about that later. Okay, so the way I've organized it, I want to talk about the social compact, the pursuit of happiness, the Greeks, the founders, sorry, and Lincoln and Roosevelt, capitalism in effect, housing as a right, New York City housing policy, and then what I'm looking at in the future. Okay. Now, this is the core of it. Aristotle wrote, "The happy man lives well and does well, for we have practically defined happiness as a sort of good life with good action. Happiness is not," he argued, "the equivalent to wealth, honor, or pleasure. It's an end to itself, not a means to an end." He recognized the difficulty of achieving this ideal and that can only occur with the right conditions, necessitating the active role of government to provide for collective well-being. And here's the quote: "An individual can only fulfill their telos to be a moral and happy human being within a well-constructed political community. The community brings about virtue through education and through laws that prescribe certain actions and prevent others." Okay. The social compact acknowledges that all individuals are inherently free. To ensure the preservation of these rights, the government is established by and for the people. Jefferson's Declaration talks about life, liberty, and pursuit of happiness. And they just go on to say the concept was set in motion by the Declaration and the Constitution, establishing an unalienable rights of the people. And happiness is a critical component of the aspiration for the new country. Without pursuing happiness and stability for which that is achieved, true life, liberty are out of reach. So here's the quote: we hold these truths to be self-evident. All men are created equal, endowed by their creator with certain unalienable rights. That among these are life, liberty, and the pursuit of happiness. That to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed, and that wherever a form of government becomes destructive of these ends, it is the right of the people to alter or to abolish it, and to institute a new government, laying its foundation on such principles and organizing its power in such form as to them shall seem the most likely to affect their safety and happiness. The happiness in this clause, the Declaration is referenced twice as a right of the people and as a responsibility of government. Um, so, this is a little bit more of the same about where Jefferson actually pulled his understanding of happiness. And I want to, in this slide, I want to just point out Aristotle, and this is critical for my connectivity with the whole thing. Aristotle used the term enema, the Greek word for happiness, when describing the highest human good, and to consider what it really is and how it can be achieved. It's a central concept in the ethics and subsequent Hellenistic philosophy. Now, this is important because this word, the synonym, the meaning of happiness reflects the translation for its Greek counterpart, and dana means the concept of welfare and the further of human flourishing, prosperity, and blessedness. Now, in constitutional law, the Declaration of Independence is a not binding legal document. The Constitution is. So this point is making a connectivity between the word happiness in the Declaration of Independence and the welfare clause in the Constitution, because happiness is not referenced in the Constitution. So, and then I talk a little bit more about life, live it, the lock, because that's really also a part of Jefferson's understanding of it and the relation with the social compact. And so this is the Constitution. And I say life, liberty, happiness is echoed in the preamble, but happiness is replaced by welfare. So we, the people of the United States, in order to form a more perfect human union, establish justice, ensure domestic tranquility, provide for the common defense, and promote the general welfare, and secure the blessings of liberty. It's repeated again in Section 8, which is the spending clause, that's codifying government's ability to raise money and providing for the welfare of its people. Section 8 shall have the power to lay, collect taxes, to pay the debts, and provide for the common defense and general welfare. Okay, given the scope, it allows government to spend money as it will. And my professor Christian Parenti actually outlines, at John Jay, outlines a bitter face-off between the Federalists led by Hamilton and Whigs. Parenti views Hamilton's interpretation of the clause as broad and expansive, and Jefferson and Madison's far more limited. Hamilton is comprehensive as any that could have been used, enabling broad spending powers, provided spending is done for the general good. Hamilton's position ultimately prevailed in the courts and the battlefield. We'll say that slavery was abolished. And so this is just how I connect the word happiness in the Declaration of Independence with the constitutional preamble and Section 8. Okay. And this is just words from Lincoln, where he actually reinforces the importance of the Declaration of Independence. He said, the Declaration is the picture, the Constitution is the frame. And that, wait, where's it? Okay. He recognizes the Declaration's creed of life, liberty, and happiness as the motivating factor for which its founders sought their own freedom. He consistently references the importance of the Declaration as essential to understanding the founding principles of U.S. and the meaning of the Constitution. All right. FDR is kind of where the rubber hits the road. So FDR, in the State of the Union in 41, reconstitutes his understanding in the four freedoms. First, freedom of speech and expression, every person to worship God in his own way, freedom from want, and freedom from fear. In the wake of the Great Depression and the war, it was freedom from want and fear that FDR believed required direct and immediate attention. In his 44th State of the Union, he called for the establishment of the Economic Bill of Rights. And in the Economic Bill of Rights, we have a number of rights, but specifically for today, it's the right for every family to have a decent home. Now, the Economic Bill of Rights, okay, is globally, four freedoms and the Economic Bill of Rights are accepted by the global community. Eleanor Roosevelt, after FDR passed, helped incorporate the founding principles of the UN Declaration of Human Rights, which includes the right to a home. Right after that, in 1944, was the rise of neoliberalism. And rather than go through this, I'm just going to give a quick example of something I found on YouTube, of course, is basically a debate between Ronald Reagan and Bobby Kennedy, and probably right before Bobby was shot. And the question, it was at the UN delegation of university students. And Bill Bradley was actually in the audience. He was actually at Princeton at the time. And somebody, it might have been Bill Bradley, raised the question of, well, how do you see happiness? And I think this is when things switched, like right around the time of Bobby Kennedy. Bobby Kennedy refocused on Aristotle and the importance of every human being having the right to achieve their life's worth. Okay. And Reagan focused on individual liberty and the ability to go on your own and do it yourself. And I think that's when government started shifting their economic policy focus and going more on individual freedoms, but also reliance. I'll just skip ahead. And I did look at Jack Ramis, Fiscal, Monetary, and External Industrial Policies, that really impacted both poverty and, ultimately happiness, which can be, identified, in the prior presentation as like time. Fiscal task policy, spending, debt management, and monetary all reduce the GDP, increase wealth and income inequality, and increase poverty. And monetary, underfunded pensions, low savings rate, non-democratic process, asset bubbles in housing and education. There's more, of course, but we'll just go through this. I want to get to New York. Yeah, these are all, so I really want to focus, capitalism is not in the Declaration. Capitalism is not in the US Constitution. It is not in the Bill of Rights. It's not a fundamental right under US law. It's an economic system. So loss of jobs, loss of income, all under capitalism policies, loss of housing. As of 2024, there are 771,480 homeless in the US, 158,000 in New York. Over 1 million people are rent burdened and pay over 30% of income. That's New York State. The policies have created an affordability housing crisis. Again, I go through what the laws actually requires of the government, and especially New York. Right now, 2.9 million people pay more than 30% of their income in rent and housing. 1 out of 5 pay more than 50%, and 25% of New Yorkers are living in poverty. The housing policy is supposed to alleviate demand-driven rents and price increases, increase housing supply and affordability, encourage construction, mandatory including housing, financing affordable development. However, what it actually does is the opposite. So between 2010 and 2020, over 185,000 new multifamily homes were built. Only 30% were designated for low-income housing and moderate housing. But between that roughly the same period of time, we lost 441,500 low-rent apartments. 5% loss between, an additional 5% loss between 2014 and 21. So it's over 526,000. There's a lot of reasons for that. I think primarily what I found is gentrification, where starting with Robert Moses, they would just tear down communities because of blight and build more expensive housing. But they would not, the individuals that were displaced did not get new homes. And that started in the 60s. And it just got worse and worse and worse. And the height of probably was the Bloomberg administration, where he served 12 years, and he just exacerbated the number of luxury housing, which I don't know if I have it. Yeah, it just end of Mitchell Lama at Koch. Because the Koch administration was actually the last time New York City actually put its own money into housing. They were relying on private. 2 minutes. Okay. So I go into a lot of the issues with respect to New York City specifically. It's just always kind of a hit or miss. And I think a big part of the issue is that we don't have the data. They're not collecting the data in terms of how many individuals are displaced consistently, and they're not, and what the gentrification means in terms of development of the city. And I also think that the city of New York allows the developers to take the lead in terms of development. There's no process by which the city has the ability to say, this is what we want for the city. And so as a result, New York is a hyper-capitalist city where many, if not most of the luxury apartments are not lived in by residents of the city. So with that, I'm just going to end this. This is also the big issue is rent stabilization, where there's constant increases of rent. And I'm going to point to the downturn in 2008. Even though we had a downturn, the rent was still raised 4.5% for 1 year and 8.5% for 2. And the base never goes down because landlords, what they'll do, instead of lowering the rent, the base rent, they'll just take them, they'll give you 2 or 3 months free. So the base rent in subsidized housing will always remain the same, and they'll always get the increases. So there's no way, and income levels are just not rising at the same level this is. So anyway, all right, and this is what. Okay, so today, the 1-bedroom apartment in New York is $5,242. Requires a salary of $209,000. The median salary in New York is $79,730. It's just not possible. So anyway, so I want to leave you guys with kind of a memory. Let me just say, oh, here's FDR. The simple basic things that must never be lost sight of in the turmoil, unbelievable complexity of our modern world. The inner and abiding strength of our economic and political systems is dependent on the degree to which they fulfill these expectations. Here's Eleanor. Where, after all, do universal human rights begin? In small places close to home, so close and so small that they cannot be seen on any maps of the world. And this, of course, are the 4 freedoms of Norman Rockwell: speech, worship, want, and fear. So thank you, everybody. Really appreciate it.